webinar today. Today, we will be talking about pharmacy-based vaccination, which is a very important topic because there are still many countries that do not have pharmacy-based vaccination in place. And the pharmacists and pharmacy associations in those countries are advocating to amend legislation to allow pharmacists to vaccinate. And there are other countries that have pharmacy-based vaccination, but they are also looking to further expand the scope and impact of the service. So today, we will be discussing and exploring some strategies on how to navigate policy barriers and how to be proactive in our advocacy efforts on this topic. And also today will mark the launch of the new FIP publication, which is the Vaccination Policy Toolkit, which has a lot of resources and actual practical tools to support pharmacy teams in expanding pharmacy-based vaccination services. But first, let me introduce myself. I'm Sherif Guorgui. I'm a pharmacist from Canada and the president of the community pharmacy section of FIP. It is my pleasure to be your moderator for the webinar today. And I also have with me from FIP, Albina, Nisa, and Imfan, who are doing all of the important work in the background to ensure that everything goes smoothly throughout the webinar and that you enjoy your attendance with us today. Before we start, we have a few housekeeping points. Please note that this event is being live streamed on FIP YouTube channel, and it is also being recorded. The recording will be available afterwards on our website at events.fip.org, and of course, it will also be available on YouTube. If you are joining us live, we welcome your engagement. We have a few interactive activities today that we would encourage you to participate in. And we also would like to ask you if you have any questions for our panelists to have them, to type them out throughout the presentation in the question box. And when we open the floor at the end of the discussion with our panelists, we will then be able to get to your questions, and we'll certainly make sure that we address all of them. And we very much value your feedback. It's very important for us to hear from you. So if you wish to provide any comments on this event in particular, or on our digital events in general, please send your comments to our email at webinars@fip.org. It's important for us to not only know what we are doing right, but also we always try to see what we can do to improve. So your comments and your feedback are always welcome. We want to make sure that we deliver content that you find that is relevant and useful to you. And of course, if you're not a current member of FIP, I would like to invite you to become a member. It's a great opportunity to join a global network of colleagues from all over the world and to benefit from all the tools and resources that FIP offers. So if you would like to learn more about the membership benefits and to become a member, please check our website at fip.org. And if you prefer to follow along with translated captions in your preferred language, you can do that with the live translation feature on Zoom. If you'd like to try that out, you can just follow the instructions on the slide. Very straightforward. Just click on the closed captions icon, enable the translation toggle, and choose your language. This webinar and the Vaccination Policy Toolkit are supported through unconditional funding from MSD, and FIP would like to acknowledge and thank them for this support. We have a panel of fantastic speakers today, truly. I will be introducing each of them more properly before their individual presentations. but I just wanted to take this opportunity now to acknowledge them and to thank them for taking the time to prepare their presentations and for being with us here today to share their insights and expertise with us. The learning objectives of the webinar today are to understand and recognize the role of multi-stakeholder collaboration to shape policies that expand pharmacy-based vaccination within national immunization programs, to apply evidence-based guidelines, to implement and integrate pharmacies into broader immunization strategies, to identify different pathways and models for improving vaccination access through pharmacies, and to become familiar with the FIP Vaccination Policy Toolkit and explore how to apply it to strengthen practice and advocacy efforts. So for our program today, we will be discussing the expanding role of pharmacy-based vaccination through effective stakeholder collaboration. We will also learn about how to integrate pharmacies into national immunization strategies, and we will learn about the journey in Ethiopia to improve access to vaccination services over there. And we will have an overview of the Vaccination Policy Toolkit, and then we will open up the call for your questions. So it's a very busy agenda. So just to briefly set the scene for the event, FIP's disease prevention program aims to advance the role of pharmacists in the area of disease prevention strategies. And a key element of this, obviously, is the role that pharmacists and pharmacy professionals can play to improving vaccination rates in their communities. The good news is many countries already recognize pharmacy's important role in improving vaccination access. In fact, FIP has been collecting data for almost 10 years to monitor the evolving role of pharmacists in immunization. And based on data from 117 countries, we found that 56 countries currently have legislation in place that support and enable pharmacy-based vaccination. 43 countries allow pharmacists to vaccinate, and 29 allow pharmacists to prescribe some vaccines. So there is some good momentum, but clearly there's still a very big opportunity to further expand this globally. Because as you see here, 61 countries currently do not have pharmacy-based vaccination services. The good news is that many of those countries are working and trying to amend legislation to enable pharmacists to vaccinate. And in other countries where pharmacy-based vaccination is already established, they are tackling a different battle. They are trying to expand that authority even further. So with that, let's get the conversation started. We want this event to be interactive. So we have a couple of quick questions for you now. And then we will have another question for you at the end of the event. So if you'd like to participate, you can either go to slido.com and enter the code that you see on the screen here, or you can just scan the QR code. So we'll give everyone a few seconds just to get that done, and then we will give you about a minute or so to start answering the first questions. And if you have any technical questions, our amazing team is on standby, so just please write your question in the chat box. Okay, so I guess we can start with the first question. So which of the following best describes the status of pharmacy-based vaccination in your country? If you can use the Slido app to answer the question. Okay, so based on what we're seeing, about 80% have limited scope, and they would fall under the category of Okay, still more answers coming. Okay. So now it's about 70% that say that they do have limited scope of pharmacy-based vaccination, and 20 have no pharmacy-based vaccination at all, and about 10% are uncertain. I'm sure we will get to that later on in the discussion. So now we can get to the second question. In less than 3 words, what do you think is the biggest opportunity pharmacy-based vaccination offers or will offer in your country? So just 1 or 2 words, if you can just write down what you think will be the biggest opportunity pharmacy-based vaccination will offer in your country. Immunity and access. Disease prevention. Access. Prevention. So again, we'll just give you about just 1 minute, and then we'll move forward. Access and disease prevention are certainly the most recurrent themes, which makes perfect sense. Access, easy access, and obviously it's easy access, convenient access, timely access. So I think we're all on the same page here. So excellent. Thank you so much for participating in this activity. I'm sure that our speakers today will be referencing and speaking to some of those responses as they go through their presentations. So with that, it is now my pleasure to introduce our first speaker, Susan O'Donnell from Ireland. Susan is a community pharmacist working within the Irish Pharmacy Union as a professional services pharmacist. Her role is to support members with the delivery of all their services and to work with stakeholders to ensure the necessary structures and frameworks are in place to facilitate pharmacists' provision of safe and effective care, and also to ensure the role of pharmacists in vaccinations is recognized and expanded upon. Susan, thank you very much for being with us today, and I will now turn it over to you.
Thank you, Sherif, and thank you for having me today to discuss this topic of addressing the expanding role of pharmacy-based vaccination through effective stakeholder collaboration. Next slide, please, Nisa. So I'll just give you an overview of where we're at now in Ireland. So currently, community pharmacists participate in 2 nationally funded programmes. The other providers of these programmes are GPs and also HSE teams. And community pharmacists now provide 30% of both of these programmes. So for COVID-19, there's 1,100 of the 1,900 pharmacies in Ireland providing this service. And COVID-19 is 2 campaigns currently in Ireland, one in spring and one in autumn. So we're currently within our autumn programme. And our autumn vaccination programme also includes the seasonal influenza campaign. So at this moment, probably a lot of the heavy lifting has been done, but we're entering a surge. So there is a lot of activity within community pharmacies currently with people presenting for vaccination prior to the Christmas season, when a lot of people tend to get sick with these diseases, these viruses. Outside of these national campaigns, we also do private vaccination services such as pneumococcal, shingles, travel vaccines, and RSV. Next slide, please, Nisa. So how have we gotten to where we are? So you'll see there that the first bubble represents 2008. And at that time, a working group was set up to look at advancing clinical pharmacy practice to deliver better patient care and also added value services. One of the key themes of this was that prevention is better than cure. And international practice had shown that a national policy was required for vaccine services and a strategy to maximize vaccine access. And pharmacy was identified as a possible network for doing so, as it had been successful internationally. So the involvement of pharmacy in this vaccination service was a key, and consideration was given to training pharmacists as required to deliver these services safely. So the H1N1 national vaccination campaign happened in 2009, and pharmacists were trained, but they were not required as vaccine uptake was low. The most significant piece of legislation that was introduced for pharmacists in relation to vaccinations was the national legislation in 2011. This allowed for community pharmacists to supply and administer the influenza vaccine in the absence of a prescription. It was publicly funded for certain cohorts, but pharmacists could also provide a private vaccination service. And importantly, the vaccination training the pharmacists had to undertake was reimbursed. 2012 saw an expansion of those who could receive their vaccine in community pharmacy expanded. And in 2012, shingles and pneumococcal were added to the national legislation, allowing for pharmacists to supply and administer these vaccine types in the absence of a prescription. But this was a private service only, and it continues to be up until now, but I will discuss that a little bit later on. In 2020, the nasal flu vaccine for children, so the LAIV, was funded through the national programme through community pharmacy. Also, it saw a change in the way of working. Incentives were provided for the number of people who had vaccines administered within a community pharmacy, and also legislation was in place to allow for off-site flu vaccinations. In 2021, obviously the COVID epidemic was underway. At the start of the national response to this, community pharmacy were not included due to operational issues. But when we were included, it was to a small cohort. However, the uptake in community pharmacy was very strong, and quite quickly, the cohorts who were eligible to access vaccination in community pharmacy expanded rapidly. And today, we provide the same service to the public as community pharmacy do. So this is a publicly funded service for all those who are eligible for vaccination. Consumables were provided to pharmacy, which was a new way of working, as up until now they weren't by the government. Management of anaphylaxis also came within our remit. Pharmacy students were viewed as vaccinators within the mass vaccination services, and importantly, HSE PharmaVax was introduced. We move on then to 2022, which saw public funding allowed for flu and COVID vaccination programs, and importantly, in a co-administration manner within a patient consultation within a community pharmacy setting. Everybody is keen to see as many pharmacies as possible providing vaccination services and for it to be considered business as usual. So barriers to engagement are a key focus, and in 2024, legislation was introduced to address legacy issues from the initial legislation from 2011, which saw administration burdens being placed onto community pharmacy, such as GPs having to be notified if a flu vaccine was being administered. With the advent of HSE PharmaVax, COVID-19 vaccines were being held on a system which all providers of a vaccine had access to a vaccination history. In 2022, flu and pneumococcal were included on that platform. So the necessity to notify a GP of vaccination was redundant really at this stage. There was also an emphasis on printing off data from HSE PharmaVax. The legislation that was introduced removed that requirement. And then we move to now, 2025, and we can pop on to the next slide there, please, Nisa. So significant work has been carried out in the last couple of months between the Irish Pharmacy Union and key stakeholders being the Department of Health and also the HSE PCRS. So these would be the department within the government who pay community pharmacy for their services. So the focus of these talks was on expanding the role for pharmacy and also renegotiating the reimbursement arrangements that are in place. So one of the key focuses that came from this from these discussions and that were agreed within the new community pharmacy agreement were immunisation services. And we are currently in the process of rolling out pneumococcal vaccination, which to date had only been private within community pharmacy, to being a reimbursed service in community pharmacy for those over 65 years old who are eligible. Pharmacy are now also going to be considered for catch-up vaccination programs such as MMR. We're also going to see a collaborative approach being considered to hit WHO targets for vaccinations which children receive, such as MMR. Travel vaccines, there's an emphasis on streamlining the patient process for accessing these vaccines through community pharmacy. And also we will be considered for new and emerging vaccines for preventable diseases. And interestingly, there's going to be an enhanced immunisation fund, which is a dedicated fund to expand the wider role of community pharmacy. Prevention and control of disease is a key, and we're seen as key to delivering that. Next slide, please, Lisa. So an excellent example of collaboration in action is the LAIV Schools programme. So traditionally, community pharmacy had delivered a huge number of LAIV vaccines to children within the community pharmacy setting, with 40% of nasal flus that were administered to children happening at community pharmacy. And traditionally, we hold, a market share of about 30%. This was noticed by the key stakeholders who are providing these vaccination services. And also another challenge was that the uptake in this age cohort of 2 to 17 who are recommended to get the vaccine remained low. And also the health service capacity is finite and they required assistance. They looked to international best practice and they saw in the UK that they had introduced the delivery of this service actually within the school setting. And they considered doing this within the Irish setting as well. And they invited GPs and pharmacists to assist them with the delivery of that. To date, within this season, community pharmacy have delivered over 60% of the LAIV vaccines. And it has been facilitated by the existing legislation that was put in place with regards to off-site vaccination and also the consent processes that have been in place within pharmacy. Added to this, the communications that have come out from key stakeholders such as the Department of Health who are seeking assistance with the delivery of this programme have highlighted that community pharmacy are being encouraged to provide this service, and it has been seen as a success. Next slide, please, Nisa. So when we think about collaboration, what would we feel are the key aspects for consideration? So it is important to identify your stakeholders. Who would be interested in community pharmacy providing this service? Are there national policies there that require assistance in order to see them delivered? Ensure that there's a local and national focus. So community pharmacies in Ireland are at the heart of every community. We are delivering a service that is accessible. And also we have communication channels that ensure that when a service is being delivered, there is wide recognition of it within the public. We introduce new ways of working. And when we've been doing that, we've been doing it effectively and safely. And, when challenges such as providing group vaccinations in an offsite vaccination centre, such as the school, have become ways of working, we have done it effectively and safely. The IT systems and integrations, these are hugely important. As you'll have seen, the advent of HSE PharmaVax has allowed for us to have visibility of records, which to date we would not have had. And the fact that this has been expanded upon is probably one of the key considerations to now us being allowed to provide a reimbursed pneumococcal vaccination service to eligible patients. There's a mutual understanding that these services need to be safe and effective, but also that the accessibility is a key and that patients need to be able to access these services. And then the current multi-stakeholder approach that we have in Ireland is fantastic. So with the advent of COVID-19 vaccination, there were new structures put in place to facilitate the rollout, the operational aspects of these programs. We have a team who assist us, or who we assist with the delivery of the national programs, and they're called Vaccination Primary Care Contractors team. They support those who provide the national vaccination programs in the communities, such as pharmacy and GP. And they're a forum which we have on a bi-monthly basis, where any issues that are being experienced or any emerging vaccination requirements that will be coming forward from on a national basis are discussed, and we can all discuss a proactive and involved approach to ensuring that these services are delivered as streamlined as possible. And it also allows us to showcase the great work that the community pharmacists in Ireland are doing and can do with regards to these vaccination programs. And I think that's the end of my presentation, Lisa. Thank you for listening, everybody. And if you have any questions, please let me know.
Thank you so much, Susan, for this very informative presentation on the pharmacy-based vaccination progress and lessons learned in Ireland. And yes, I'm sure there will be a lot of questions later on that we will get to at the end of the webinar. I would like to now introduce our next speaker, Salah Andil Shubair. Salah is the Deputy CEO of Tawreed in Jordan. Thank you so much, Salah, for being with us today. The floor is yours.
Thank you, Dr. Sherif. First of all, I would like to thank you for this invitation, and it's a privilege to be here today to discuss the critical evolution in our health landscape, the strategic integration of community pharmacies into our national immunization framework. We will journey from global recommendation down to the localization in Jordan, and finally to proposed model for Jordan pharmacy-based vaccination expansion. Next, please. To guide our discussion, we will follow a clear roadmap. First, we will examine the global evidence and recommendation that make the case of pharmacy vaccination. Second, we will discuss the crucial step of adapting these international guidelines to our unique Jordan context. Finally, the most importantly, we will outline the concrete actionable model for making vaccination as a cornerstone of public health in Jordan. Next. The world has already spoken on this issue. Major global health bodies are not just supportive, they are actively advocating for the role of pharmacists in immunization. The WHO sees the pharmacist as crucial for primary care, and the FIPs setting global standard for their training, and countries like US and UK have decades of evidence showing that the pharmacies dramatically increase vaccine access and coverage. This is not an experiment concept, it's a proven global public health strategy. So from here we started, next please, that we are talking about the 4 key pillars, which the pharmacies break down barriers of time and distance. This is the access, and they making them powerful tool for equity, and they strengthen our entire health system by sharing the load, and perhaps most important in post-pandemic world, the leverage precision resources and the inherent trust of the public has their local pharmacists. We gain the trust from the citizens. So we cannot simply copy and paste the model from United States or Portugal or UK or USA. The critical second step is localization. We must carefully adapt these global recommendations to fit unique legal, structural, and cultural. Next, please. So, we must carefully adapt these global recommendations to fit the unique legal, structural, cultural, and economic realities of Jordanian healthcare system. This is an essential work that will determine the success or failure of the vaccine in pharmacy initiative here. Next, please. So, what is our starting point? As a quick SWOT analysis reveals our powerful assets as a pharmacist, widespread network of pharmacies and trusted profession. It's also highlight a clear opportunity in adult and refugees health. And in Jordan, we have a lot of refugees in our country, but we must be honest about the challenges. The primary barrier is the current regulatory framework. When we started, it is not allowed to give the vaccine in the pharmacies. So was a main barrier and main challenge to talk with the Ministry of Health and the stakeholder in order to get this approval, followed by need of seamless system integration, and acknowledging this is the first step of overcoming it. So we already get the approval for this regarding the approval of uh, the MOH for having vaccination in pharmacies. We have you can see that the strengths and the weaknesses. It is we have a lot of challenges also and opportunity. So at certain point we can talk about planning for based on this analysis. Next, please. Now let's build the Jordanian model. We have a localization. It's slow, but it is evidence-driven phased approach in order to success. We propose three-phase model. First, beginning with tightly managed pilot to prove the concept, followed by strategic scale-up, and then the maturity stage. Also, we have a key focus areas, which is awareness. We need to have awareness to the pharmacies and to the citizens also, and regulatory foundation and training and certification, system integration and quality assurance. So this is this was made as a phased approach in Jordan. Now, next, please. Now, if you can see that we have the phases, and we have the phase one and what we can do in each stage, and what is the main factors we are talking about. Now, let's talk about next, please. Let's talk about the phase one. Phase one, it's about building our case with local data. We started small and controlled survey to citizens and to the pharmacists about the role of pharmacy, and some question, and this was made by third party. We started with a flu vaccine for adult, and the cornerstone of this phase is obtaining temporary legal work. So in parallel, we work in that, and we already achieve those objectives. And the success of this pilot will be foundation for everything that follows. So we get the approval, and we before the approval, we started the study from third party, and then we have certain certain instruction and allowance from the MOH in order to get the approval for having the vaccine in pharmacies. Also, this was combined with training and awareness also, and we translate some of the publication that published by FIP. We translated to Arabic and we distributed to the pharmacies and the citizens. Next, please. Now, the second phase is the strategic scale up with positive result from pilot. We expect to phase 2 to begin. This is where we move from project to program. It's not only project, it will be a program. We use the pilot data to advocate for permanent change in the law. And we expand the list of vaccines. Now we are in the pilot, it's only one vaccine. Now we are looking to expand list of vaccine that pharmacists can administer. We work to create a sustainable payment model with the insurance, and maybe we go further that MOH will give the vaccination to private pharmacies. So we were in discussion about this thing, and we tell the public loudly and clearly that their local pharmacy is now official trusted place to get vaccinated. Next, please. In the final maturity phase, pharmacy-based vaccination become as normal as filling a prescription. It's embedded in university education, ensuring all future pharmacists are prepared. The network is ready to activate assist for any future pandemic. We continuously monitor quality and look for a new opportunity, ensuring the system remain effective and responsive for years to come. So we are, and also it will be related to continuous training and education. So this is the phase 3. Hopefully that we can get it after the phase 2. And I think, and I believe from the result of the pilot scale, we are moving toward this. And by the way, it's also the role of the pharmacist during Corona and vaccination with the government give the trust to pharmacists that he is able to work. So this is a good indication that we get the right pilot trial, and then we will move to another phase. Next, please. We are, in order to have this project, we need to have the key performance indicator. This model is ambitious. It's achievable. So we are in order to get the information, we can't. It's not. We didn't do any study till now, but we have to work in a study after the pilot that the vaccination rates, the equity gap reduction, and target population reach, and the geographic coverage, and other thing which is related to the key KPIs. So we can note that the 35% there are increase in adult vaccination. So, but the other KPI we didn't measure it, but it must be measured maybe during the next year we will work in KPIs. But one of things that this program have a success that for example, now we don't have in the private market any flu vaccine. It already all was have the vaccine, and it's out of stock. And there is a lot of people asking the vaccine, but it is not there are no vaccines. So because the people go to pharmacy, it is easier. So we can touch this, and we can feel that this program is succeed because we can get the feedback from the companies who supply the vaccines that there are no stock now in Jordan. Next, please. In a conclusion, the global guidance is clear, the local need is evident, and a practical path forward exists. By strategic integration, our extensive network of community pharmacy into national immunization strategy, we can increase access, promote equity, and build stronger shield of protection of all Jordanians. This is a transformative opportunity. Let us work together to seize it. Thank you for your time, and I'm ready to answer any question after this session. Thank you.
Thank you so much, Salah, for this very insightful presentation about the experience and lessons learned from Jordan. I would like to now introduce our next speakers, Aisha Nasser and Imfan Timothy from the FIP team. Aisha is the Equity RX intern at FIP, and Imfan is a program coordinator at FIP for disease prevention and self-care. Aisha and Imfan, thank you for being with us today. I will now turn it over to you.
Thank you very much, Sherif. And a big thank you to all our speakers that we've had so far. Dear colleagues, it's a pleasure to be with you today. Thank you for joining us for this event.
Aisha, Imfan, we lost you.
Alongside our intern, Aisha, we are pleased to give you an overview.
Imfan, there is a challenge with the connection. Maybe it's you can try to do it without the video.
Okay. How's it now?
Yeah, now it's good. Yes.
Okay, thank you. So I was saying, thank you, colleagues, for joining us today. It's my pleasure to be with you. Today, alongside our intern, Aisha, we're pleased to give you an overview of our new policy toolkit, and we encourage you after this event to explore it further. Just as Sherif had said earlier in this webinar, between 2020 and 2025, we have experienced a 57% increase in the adoption of pharmacy-based vaccination services worldwide. But we see that there are countries that don't have this service, or some that do have it, but are looking to either expand the role of pharmacists or optimize implementation. So today, FIP is delighted to launch this toolkit, which is designed to support countries in advancing pharmacists' role in vaccination and improving access to life-course immunization. This toolkit provides practical strategies and policy options for expanding PBV at various levels of maturity and implementation. You can scan the QR code that you see next to access this publication, or you can check in the chat box. There's a link that you can access this resource through. I would like to extend a big thank you to the FIP team who supported the development of this toolkit. Hanadi Alolime, who's our unitary and provision coordinator. Aisha, who's on this call with us now. My colleague, Dr. Dalia Badges, who's the head of the program and provisions here at FIP, and also our CEO, Dr. Catherine Dogan, for her insight, which has really helped us to get to where we are with this publication. Next slide, please. So aligned with the WHO immunization agenda for 2030, and FIP's development goals, this toolkit reflects our commitment to ensuring no one is left behind in global immunization efforts and to accelerate vaccine equity, access, and resilience through pharmacist-led services. So typically, new or changing legislation can be slow and difficult to draft and enact, but regulations can be made through a simpler and more agile process. Therefore, this toolkit can support countries to establish or even update their regulatory frameworks, which will now enable pharmacists to administer and even prescribe vaccines. And then they'll also develop a skilled and agile pharmaceutical workforce that is capable of providing these services in their communities. Can also support countries to bolster access, equity, and integration within the national immunization strategies so that these services reach a wider population. And then it would also increase vaccine coverage, build the public confidence in pharmacists to provide these services, and also enhance the convenience which we provide for these services. Last but not the least, this toolkit can also support countries to position pharmacists as essential contributors to national and global health goals. This toolkit is for countries who have that have a limited scope of practice, can be used by policymakers, regulators, pharmacy leaders working to introduce, strengthen, or scale up pharmacy-based vaccination services in their countries. Next slide, please. Thank you. There are 10 sections in this toolkit, which will give practical guidance. And a successful life course vaccination program can improve the health of the whole population through both direct and indirect impacts, such as improving productivity, increasing healthy life expectancy, and reducing long life disability. Therefore, the introduction of this toolkit, which is the first section, highlights why pharmacy-based vaccination matters. It also talks about the global advocacy around PBV and the rationale for it. If you move a little bit, one more step, please, Nisa. The second section, which is about policy and regulatory foundations, provides a categorization of countries based on pharmacy-based vaccine, on pharmacist administered vaccination policies. Now, we got this categorization from our 2024 Global Intelligence Report, which is updated on our Surveillance Atlas and is accessible in the link that has just been posted in the chat box. So in case you are unsure of where your country is with pharmacy-based vaccination, a quick look at the category in this section will provide the knowledge. Next slide, please, Nisa. So whether you're introducing pharmacy-based vaccination or expanding you're expanding it, advocacy. So section 3 of this toolkit provides guidelines on 1, how to map your audience, collaborate, communicate, and coordinate even with stakeholders to garner support and establish productive interprofessional relationships. It also gives key recommendations for policymakers. The public influences pharmacy-based vaccination legislation through the acceptance and demand for vaccination services in pharmacies, often driven by educational campaigns that raise awareness and build confidence in pharmacists' roles in vaccination. Therefore, in this section, you will also see how to engage with the public, as well as some examples to initiate this awareness in your respective countries. I'll now hand over to my colleague Aisha, who will take us through the rest of this presentation.
Thank you so much, Mafone. Can we please go on to the next slide, Missy? Thank you. The next slide again, please. Yes, thank you so much. I'll be giving an overview of what the next 3 sections of the policy toolkit entail. So starting with section 5, which highlights how developing a competent and sustainable workforce is essential for the effective delivery and expansion of pharmacy-based vaccination services. So investing in workforce development, supported by internationally recognized tools and accreditation programs, is essential not only for maintaining high standards of practice and patient safety, but also for building a pharmacy workforce that is capable of driving innovation and equitable vaccine delivery. So moving on to the next slide, please. The existence and scalability of pharmacy-based vaccine services rely on financing models that are consistent, adaptable, and tailored to the specific context of each country. So long-term sustainability is essential for these services to deliver consistent access to vaccines. And Section 6 provides some considerations for remuneration and strategies to enable the sustainability of pharmacy-based vaccines. Moving on to the next slide, please, Mr. Irrespective of which category a country belongs to, it is essential to monitor progress and ensure equity of access to the vaccines that are appropriate for each age or population group, especially for special at-risk groups who are vulnerable to the consequences of vaccine-preventable diseases. So in Section 7, we outlined a structured approach and provide a practical checklist for policymakers and pharmacy leaders to establish or scale pharmacy-based vaccination services that are inclusive, sustainable, and quality assured. I'd like to hand over the presentation back to Mafone for the conclusion.
Thank you so much, Aisha. So if we go to the next slide. If we go to the next slide, we'll see the pathways to the transition for the countries with no PBV. So for countries that have no PBV, we have outlined this pathway that can be adopted for this. We have recommended a 5-step approach that can be leveraged to progress to initial advocacy or emerging PBV practice. This includes data collection and situation analysis, and then you would move to developing amendments to existing regulations around PBV. The 3rd step would be to initiate the pilot project and then evaluate and scale up this pilot project, and lastly, integrate into national immunization program. This way, you would move from no PBV to initial advocacy for that or emerging practice. If we move to the next slide, you will see that for countries that have a limited PBV scope, we also recommend a 5-step approach that can be leveraged to progress to an institutionalized PBV practice. This includes reviewing existing policies that are around PBV and then generating the evidence required, as well as scaling up the pilot projects that are already in action, then implementing accreditation and competency frameworks. The fourth step would be building sustainable financial models, and finally, institutionalizing expanded pharmacy-based vaccination. So for either category that your country is in, there are key learnings from countries in this toolkit that have successfully implemented these. We have some key learnings that can be adopted, or you can look at it to see how it is done how it was done in those countries. So in conclusion, globally, pharmacists continue to contribute to pharmacy-based vaccination and these strategies, and that way they have increased access and uptake in many parts of the world. We've seen this even post-pandemic. And then with the current global data that shows that there's a plateau in vaccine coverage and there's also hesitancy, there is a need for new methods to be adapted to deliver integrated, people-centered health services. Therefore, immunization programs will also need to and established as delivery points of access between immunization and other health interventions for different target age groups. Lastly, by applying the guidelines we have in this toolkit, as well as implementing inclusive vaccination strategies that we have mentioned in the transition pathway, policies can be initiated, can be adopted, or even expanded. This way, pharmacists will be able to work towards achieving health equity and ensuring everyone at every stage of life benefits from the protection that vaccines offer. In this next slide, you will see the various resources that FIP has to support pharmacist-led vaccination services. And you can access them on our disease prevention website by scanning the QR code that you see in the top right of this screen now. You can also use the link that's in the chat box to access this website. We hope you find these toolkits we've launched today, as well as these resources and many more on your screen, useful in your practice. Thank you so much for your time. Over to you, Sherif.
Thank you so much, Imfan and Aisha, for this very informative presentation about all the great work that the FIP team has been doing on developing these truly valuable tools and resources. The email about the toolkit that you were referencing actually just came out a few minutes ago. So I'm sure if you're listening to us, you would have received that in your mailbox. So we certainly encourage everyone to check it out, and also to check out the resources that were just referenced on that last slide. And I also want to thank all our speakers for their great and excellent presentations, and for sharing your valuable expertise and insights with us today. So I'm sure there will be a lot of questions to engage in and to discuss. So we'll be opening the floor for questions very shortly. But before we do that, we have one more interactive activity. So please go back to slido.com and enter the code on the screen, or you can scan the QR code that you see on the slide. And the question we would like to get your input on is that after listening to all of the presentations today, what do you think is further needed in your country to implement or expand pharmacy-based vaccinations? Again, in one or two words. We'll just give a minute and then we'll proceed with opening up the floor for the discussion. So far, it's just says data, which I think is certainly a very important point. Recognition, regulation, government support, access. Political willpower, that's absolutely correct. I always say that the main difference between pharmacists' scope of practice in different jurisdictions is the regulatory landscape and the political will. And I think it may be part of the conversation today. We can see how we can influence that political will, because not all the countries that currently have pharmacy-based vaccinations ended up having that landscape in the past. We had to work on addressing that. So I think it would be a good conversation to share some of those lessons. Education, obviously. Budget, which is reimbursement. So thank you all for participating in this activity. Maybe before we open up the floor for the questions, maybe we'd like to ask all of the speakers to turn their cameras back on and maybe just get some high-level feedback from you on what you think about the answers to those questions that we just received. Anyone would like to tackle that?
Is this a question in relation to tackling vaccine hesitancy as a rising challenge, Sherif?
Yeah, just on that particular question that we see now on the slide and the responses. Again, many of them are very valid. Obviously, you can see the wide spectrum of the scope in the different countries based on the answers received. So any high-level thoughts on that, Susan?
Yeah, I feel that people have gotten it there in a nutshell. So you need the government framework, you need the policies there, you need the will to increase vaccination levels throughout the country, and that was one of the key pieces for us. The targets that are set, if they're not being achieved, they need to look at other channels. So if the key stakeholders who facilitate the scope and scale of pharmacy practice acknowledge the ability that is there within this uniquely trained workforce, and the framework is there to allow you to be trained appropriately. When deficits in current campaigns that exist within that country are there, the pharmacists can raise their hands and show that they have the skills and can help to achieve both a national and international need, which is increasing vaccination rates.
100%, and I think that from a FAP, a community pharmacy section perspective, we're trying to do a similar thing in India now. It's been a project that we've been working on for a couple of years, where we're looking at, and we have actually trained pharmacists in India and had that cohort train other pharmacists, or train the trainer model. And we basically trying to support the association's effort in advocating with government by letting government know and policymakers know that we actually have educated and trained pharmacists who can actually support in a public health mission in terms of getting as many people of the population vaccinated. So it goes hand in hand in trying to get the training and support done first to try to also make the case for the advocacy there. Salah, any thoughts from your end based on the experience in Jordan on those responses?
Yeah, about the response of the population or the impact of the you ask about the impact of the pilot trial.
In terms of, again, when I look at the responses that we got to this particular question, there are a lot of things that are valid there, and it does speak to the different states where every respondent country is at. So some are talking about having data. Obviously, again, if you have data, that supports with advocacy efforts. You have the training in place, the government support, the government will, the political power that was mentioned a few times. Obviously, again, when you started in Jordan, how were you able to influence getting the government support and the political willpower to support with that?
Yeah, first of all, we started, as I mentioned before, a survey, and it was made by third party. We have agreement with company to make a survey with certain questions, our questionnaire, and we get those data and closely with the international guideline from WHO, from FIP, and the documents, we offer all these documents to the Ministry of Health, and we have a committee which was led by Dr. Samira Al-Khsous. She was the vice president of the FIP, and we already have a complete file regarding this project. It's still project till now. So we get the approval from the Ministry of Health to start the vaccination in the pharmacies. So it's something related to having a third party in Jordan. Our strategy was to work with the guidelines plus the third party and the opinion of the citizen and opinion of the pharmacist and the people there. So this is the first entrance was, and the training is very essential because in the guideline we get it from the Ministry of Health after approval. They ask us to have the training, certified training. So we have a problem in that there are no certified centers. We try to talk with the some international centers. Then after Corona, we have some local certification for this training, and they have the a full training regarding the how to have the injection and what is the emergency tools, what to have to what the essential things to be done if you have the vaccination. So we have an extensive training. So and we started with the flu vaccine for adult. So this is I think if you need to work in any state, I think this roadmap will help any country to get the approval and to start the vaccination. And the response is very positive from the stakeholders, which is the MOH and the health care worker, and also even from the companies. They support because they want to spread and increase their sales. So this is not, we are not talking about that, but I want to give you the whole picture in Jordan and including all the stakeholders. So this is the if anyone want to start, I think this roadmap is good. and it works in Jordan.
Thank you so much, Salah. And maybe to follow up on that, and you mentioned stakeholders, and again, this is also for you and Sudan as well, based on the different experience in your country. How was the response from stakeholders like the physicians or other healthcare professionals? And how did that impact the advocacy work for getting pharmacists' scope of practice to be expanded? And how did you handle that?
I can take that to start with, Sherif, if you like.
Sure.
I think at the start, with any change, there was hesitancy within other healthcare professionals who were providing the services. There was concerns that maybe they would be less busy as a result, and that they would be losing patients who they enjoyed interacting with, and that they were providing a safe and effective service, and it was a new concept for them. But actually what happened in the earliest stages of the flu vaccination was that those who were being vaccinated expanded. It wasn't necessarily that we were taking from anybody else's cohort who may have been seeking vaccination there. And even to date, you'll see within the trends of people who come to pharmacies, the older and more chronically ill who are with their doctors more often, they do seek vaccination within their GP practice. And it's probably due to ease of access, really, because they're probably going to see their GPs anyway for a routine review, and they tend to get vaccinated there. For those who are more mobile, may tend to come to community pharmacy, like those who attended mass vaccination clinics. They were stood down about 18 months ago. And it was anticipated by the health service executive who oversee the running of these national campaigns that people would seek their COVID-19 vaccination. Those patients, those who traditionally went to these offsite locations, such as a mass vaccination clinic, will come to their pharmacy because we're open longer, and they probably they're probably healthy, more familiar with just coming to the pharmacy for routine medicines. And that's actually what did happen. With regards to, I suppose, collaborative working, what has happened now is traditionally it used to be go talk to the HSE about getting your vaccine or your GP. And now it's kind of common messaging across all of the communications that go out. So if somebody speaks about vaccinations, it speaks to your GP or your pharmacist. So there's kind of an equality of access piece there as well that everybody's acknowledging, and that the ultimate aim is ensuring that the population is vaccinated, and that at times, such as particularly with COVID and flu, where we're heading into a really heavy winter season here now, where we know that all services, primary care or secondary care based, are going to be under severe pressure. And the one way to help everybody to treat their patients in the best manner is to ensure that they're vaccinated prior to that. And there's an acknowledgement that ensuring that they're vaccinated at this time is the key priority. So that has helped too. A lot of messaging around that.
100%. Salah, anything that you want to add to that?
Yeah, you know, Sharif, that in our country it's different because doctors make a profit from vaccines at first think that he feel that he will lose his business or those patients or citizens. So we highlight something that we want to expand. Our message was we want to expand the percent of people who are vaccinated with the flu vaccine. So it will not affect your business, and it will instead you will have more people come to have vaccination, because there are some people trusted doctor and there are people trusted pharmacists. So because of that, it was in the first when we started, it was a little bit worried for us, and it have been a problem. But when we talk with the physician and we talk with the stakeholders, they feel that yes, the percent of the patient who come to the clinic increased. So this was our aim, that we don't want to compete physician, but we want to increase the people who are vaccinated.
100%. And just as a follow-up to that and to what Susan said, because we've experienced the same thing in Canada as well, and our position has always been that this is not a turf war. It never has been a turf war, and it never will be. The point here is how to actually work together to further serve the population as a whole and increase the vaccination rate. And our position has always been that there will never be an empty seat at the doctor's office or an empty bed in the hospital, but we just want to make sure that it is the right patient in that seat or in that bed. So if there are some services that pharmacists can take over, similar to the vaccination piece, that will allow doctors the time to look after more serious cases, then that's how we can collaborate together. But obviously, like anything, it does take time to get through that and a lot of education. The reimbursement part is certainly very important. So getting the scope is one thing, and but ensuring that it is sustainable is something else, because pharmacy, community pharmacy, at the end of the day, is a retail business. You have to keep the lights on, you have to hire people, you have to provide the service, and so on. So can you walk us through how were your advocacy tactics and efforts on that with the government to make sure that the scope is coupled with fair and equitable reimbursement?
Would you like me to take that, Sherif?
Sure, please go ahead.
I suppose, firstly, I know it's a piece that awareness has been raised around before. It is important for pharmacists to acknowledge the service that they do provide in their day-to-day business to patients, and to view it as a service, and to try and be confident in asking to be paid for services that you do provide. So in Ireland, certainly, there has been a tendency to do an awful lot of work that goes unrecognised and maybe unvalued. So with regards to vaccinations, we were putting ourselves forward as a capable and competent profession who were going to provide equally as safe and equally as effective service as the other providers. And, you know, the other providers are being paid a rate, and there was no reason why a rate that we were going to be paid should be any less, as the service we were going to provide was going to have equal safety, efficacy, and effectiveness. So that would be a key point. And also, when vaccinations are provided within the pharmacy, obviously we don't have any role to play in what a pharmacy charges, but we do say to people, reflect on the time, effort, skill, training, all the pieces that go into providing that vaccination. And if you're demonstrating that you have confidence that your service is worth X amount, it makes it a much easier ask to ask a government to pay the same amount that you're willing to ask a patient. You can't really ask the government to pay any more than you would ask a patient to pay one-to-one. And on the same basis, it makes it a hard argument for somebody to say, well, you know, we have a place to ask you to be paid less for that service.
So just a couple of points on that. It's very interesting because from one end, if the government is already paying other healthcare providers for it, then wouldn't the argument be as to you should pay us as you're paying other healthcare providers, and not necessarily related to whether or not pharmacy is charging for it? That's just one part. And then the other part, which is certainly requires a bit of a culture change, is getting pharmacists to be comfortable with charging patients, because that is something that, for the most part, pharmacists are very good and keen about providing the service, but not necessarily asking to be compensated for it.
Okay, so the first question is, if they're paying somebody else, and why would you want to be paid, is it?
So if the government is already paying for the public flu shot or public COVID vaccine through public health clinics or through doctors' offices, then wouldn't that automatically qualify as also you have to pay pharmacists for providing the same type of vaccine, right?
I suppose it's probably about the emergence of newer services. Maybe probably vaccines is a bad example there, but just say if it was a country where vaccines weren't being administered, and for, I don't know, but like maybe if they're providing a service, like we're moving into common conditions service space. And, you know, that is people coming in with potentially a sore throat who you're going to consider to do further investigations on. And if you were providing a consultation to these patients without charging them a fee, if should national funding be considered for that service, it would be very hard to turn around and say, well, I've been doing it, you know, pro bono up till now, but now I feel I actually warrant payment from the state provider. So it's just, if you are doing a service, to ensure that you review the service from start to finish, that a lot of the time it is a multidisciplinary approach. So sometimes you will be pulling a technician away from something that they will be traditionally doing within your pharmacy setting to provide this service. So they may be spending 10 minutes to prep your consultation room. They may be greeting the patient. They may be supplying them with the consent form, albeit the pharmacist is reviewing it. And that you actually do view it as bodies of work as opposed to something you're just doing because you're a pharmacist.
100%. And I think that as we get into other further expansion of scope, like minor ailments and assessment and prescribing and others, that argument certainly it becomes even more important. Salah, anything from your end on that particular point? Pharmacists getting reimbursed?
In Jordan, there are no embarrassment for the vaccines except the elderly who have a certain kind of diseases like cancer or any autoimmune diseases or something so many companies, insurance companies reimburse those patients. But in general, it is not reimbursement, and if you want to go, you can go to MOH centers, and you take it free of charge for the flu vaccine so far. So and there are no services for pharmacies. It will be included in the price. The service will be included in the price of the vaccine. And in general, it is not considered as a medication to be priced by MOH. It is freely priced. So because they added on top of the price. So this is the situation in Jordan, and this make it easier for cash payer, because you know that it is better for the pharmacies not to wait to reimburse them. Now there was a plan that MOH will give all the pharmacies the vaccination for the vaccine flu. But there are some logistics and some financial borders, and there are something which affect this project, and it's stopped. So the situation now, let's say about 90% of the vaccines in private pharmacies are cash payer.
And I think obviously the situation in every country is different, and I think the main point here is how do we make sure that the expansion of services in pharmacies are sustainable, and obviously that will depend on the situation in every country. The conversation with you, Sudan and Salah, is great. I think we can easily go for 1 hour. I want to pick your brain on a lot of things here. But we are just getting close to the end of the webinar. So we have some questions in the Q&A box that we've received. I think a couple of them are outside of the scope of the discussion today. So we will not be addressing those. We can certainly look at maybe having different webinars to address some of those points specifically. But I think one of the relevant one is about vaccines hesitancy. and obviously for asking for scope to vaccinate and even expansion of scope to vaccinate, it's important to have the public support, and the public support is clear, and we're seeing it in terms of our ability to provide it, as you've noted, students safely and effectively. But what about the vaccines hesitancy in general, and how do we tackle that from a pharmacist perspective?
It is a barrier to engagement with the nasal flu vaccine for children that we're encountering. I suppose up until now, community pharmacists have been dealing with parents who have presented in the pharmacy actively seeking out vaccination. You know, they've either completed a pre-consent form, or they've, you know, arrived in asking, are you providing the service? But when it has gone into the school setting, messaging around the provision of the service tends to go to group, and it's dramatic how the influence of one person's opinion can significantly decrease those who are seeking vaccination, who may seek vaccination through that service that's been offered. One piece of work that we're involved in at the moment is ensuring that all of the messaging, so obviously by having pharmacy involved, it is another voice of robust information and another site that patients can seek out conversations. And particularly in pharmacy, they'll be having conversations anyway, and they'll be used to having these conversations, and it may provide them with an opportunity to discuss their concerns that they have in relation to vaccines. And actually during the COVID-19 pandemic, those who presented to community pharmacies, there was a trend that certain cohorts who had concerns or fears, or, you know, just wanted to sound check their understanding of vaccines, did actually go to pharmacies. So another key point outside of that is that to ensure that everybody who is speaking about a vaccine, diseases, the benefits of vaccination, the risk of vaccination, that they're all using the same robust information. So be it their GP, be it their pharmacist, be it a leaflet that they pick up somewhere, that all the facts, figures, and statistics in relation to it, and all of the knowledge and all of the information that you're trying to get across to the patient are consistent, no matter who the provider is. So it takes some joined up thinking, but it's the only way. Like, we know ourselves how often we need to see information to have fully assimilated it. And that is the same for vaccine information. And to also, there is a drive in Ireland towards literacy, to acknowledging that not everybody, no matter how well educated, have excellent literacy, and to ensure that whatever communications that are being put out are simple, easily read, and they're not too burdensome for somebody to read and to try and understand.
100%, and I think, you know, that will be a continuous and ongoing work on that. With 30 seconds, any last word you'd like to share?
I suppose we're reaping the rewards of a lot of slow and small pieces of work that have proved to be hugely beneficial in increasing accessibility to vaccines. And we're very excited about seeing the expansion, all of those pieces that I outlined that have come through the community pharmacy agreement. And, you know, keep the faith. You will get there, and small wins, and just look at the bigger picture and try not to see it as what your one pharmacy is trying to achieve. See it as what the country as itself is trying to achieve with regards to patient protection and, you know, helping the patients in the bigger picture.
Very well said. Salah, same to you. Within 30 seconds, any last words?
I think that the vaccination is, I think, which have the pharmacists have to be its role in the society, and you know that we are we are the most people working with the patient, and we are the closer to them. So hopefully that we can see another model, and in the countries that apply the vaccination, and we are ready to have any help to the people in any country want to support or any information or any advice from Jordan how we could do this project.
Excellent. Thank you so much. And thanks everyone for your participation today. There was certainly a lot of great information that was shared today. So if you would like to listen to this webinar again, or if you'd like to invite a colleague to listen to it, the recording will be made available on our website at events.fip.org. And also when you're there, you can check out our upcoming events and make sure to register to attend them. And of course, I would like to remind you of our upcoming Congress in Montreal, Canada, which is supported by the Canadian Pharmacists Association. It will be held from August 30th to September 2nd. So please mark your calendars. And also some other important dates to keep in mind. The abstract submission deadline is March 18, 2026. The early registration fee deadline is June 3rd, and the second registration deadline is August 12th. So I hope to be able to see you there. I promise you it will be a fantastic Congress. It's a great opportunity to network with colleagues from around the world and to learn and share best practices. And I just want to take this opportunity on behalf of all Canadian pharmacy professionals to welcome you here in Canada. We're very excited about hosting the FIP Congress, and really can't wait to see you and host you. So with that, we are now at the end of our event. Thank you so much again to our fantastic speakers. And thank you to the always amazing FIP team for your great support. And thank you all for making the time to join us today. I hope you enjoyed the webinar. Have a great rest of your day, and we'll see you at